Good morning. This is Leah and Megan with Revolution Wellness Collective, and this is our podcast, Hold My Protein, Watch This, where we talk all things trying to navigate health and fitness in a world where no one really seems to understand what that is. Today, I will be interviewing Megan about exercise and pregnancy. One thing we hear a lot, this is Megan's favorite topic, by the way.
Yes.
Megan is fired up, so grab your popcorn, buckle your seatbelts, because we're going to be here for like 9 hours. Um, but
I didn't sign up for 9 hours.
we'll make you more coffee. Anyway, one thing we hear a lot in general is a lot of just myths and misconceptions about pregnancy. And a lot of them are around just exercise, people hearing crazy things like, you can't lift 20 pounds or more when you're pregnant, or, don't exercise, or don't do this, don't do that. And it's really hard to know, what can I do? Because if you listen to all those rules, you really can't do anything. And that can be really overwhelming. So
Stay in your house. Don't move. Don't pick that up. Don't go walk. Don't pick up your other kids. Your vagina's gonna fall out. Yeah, stuff like that.
yeah, so just like that in the real world, Megan is acting just like the typical advice giver. If you haven't heard it, now you have.
Are you sure you're supposed to be doing that? Is that good for the baby?
So we're diving right in. So Megan, can you just tell us a little bit about your background and why you specialize in pregnancy and postpartum care?
Sure. So I've been a PT for about 20 years. Um, Prior to about 2010, 2009, 2010, I was like very into sports, and like that was it. I was a sports PT, outpatient orthopedics, like keep me away from the body fluids. I don't want to deal with any of that. Um, and I started working with a lot of runners, and I really loved that. It was super fun. And then a lot of my runners became pregnant. And because I went to PT school 20 years ago, maternal fetal medicine was not a standard part of PT education. So we didn't learn anything about it. Like, I remember my first pregnant client showing up, and I literally thought I was going to kill her. I was terrified. I had no idea what I was doing. I felt like she was this like fragile thing. And I went through the American Physical Therapy Association's first certificate of achievement program in pregnancy and postpartum physical therapy. And so that was a 3-part course series that took about a year and a half to get done. And we did that. There was a group of, I don't know, maybe 20 or so of us that I think made it through the whole thing. And then it culminated in a case study that we had to submit. So it was a legitimate, like, ongoing certification. And the women who developed that, I hope maybe they can hear this at some point because they were really wonderful. Cindy Neville and Rebecca Stevenson were some of the two big, I guess, like grassroots pregnancy and postpartum PTs that started to develop that course. And Darla Cathcart, she is now our public health director. She's amazing. And I just learned so much from those women, and really, like, I would not know what I know now if it wasn't for them. So thank you.
All right. Following up on that, how is your approach to pregnant and postpartum exercise and healthcare different from other people's?
So social media, I think, can I rant
Go
to
for it.
answer this question?
That's why we have a
Okay.
podcast.
The podcast is really just a platform for Megan to rant. So social media, I think now that it is what it is full of a lot of misinformation. And there are a lot of influencers out there who will promote themselves as like a pregnancy and postpartum exercise specialist or something like that. Some of that is very well steeped in science, and some of it is just bullshit, if I'm being honest. Um, According to both the American College of Obstetrics and Gynecology and the Canadian organizations in obstetrics and gynecology, anything that you did prior to your pregnancy, you can continue to do in the absence of any complications. And so if you are, the average woman in the United States is in her late 20s to early 30s when she has her first child. If you don't have high blood pressure, if you don't have diabetes, or any other like autoimmune diseases, things like that, if you don't have a pre-existing condition, you can just keep going. Where I think we need to do better is telling moms what they need to look out for, because it also is not the time for you to go like, I don't know, max out your back squat. Like doesn't sound smart to me.
Are there any specific types of exercises that are particularly beneficial during pregnancy?
All the exercise. Again, I think you gotta well, let's talk about why exercise is beneficial.
Okay.
Okay. So as you see next to us, we have what did we name him again?
Ooh, Percival?
Percival. We have Percival the penis. But we also have Penny the placenta. So this is I think on the I Heart Guts website, they call this baby's first womb mate, which I think is really cute. So I have the placenta because I think it's pertinent to this conversation. So as you are pregnant and your pregnancy progresses, your blood volume, so the amount of blood that's in like circulating through your body, increases by up to maybe even over, depending on who you are, 50%. And that makes sense because almost all of that excess has to go to the placenta, and this is how baby gets all of its nutrients. So blood flow is really, really important for a healthy pregnancy. That being said, any type of exercise is good for pregnancy to improve blood flow and circulation. Now, you're also tired because, hello, you're growing another human. I remember when I was pregnant with our son, my first trimester, I was so tired. And it was like once I hit 20 weeks, I felt so much better and I had a ton of energy for about, I don't know, 2 months. And then towards the end, I was just like, dear God, get this kid out of me. I'm done. It's important to continue the exercise that you were doing before you got pregnant so that you can manage blood flow, blood pressure, fatigue, energy levels, and also prepare for labor and delivery. But it's also important to not exercise when you're already tired. So there were a lot of days that I would have to do, I guess, kind of some soul searching and figure out like, am I tired, like fatigue tired, or am I just tired because I've been working a lot and I didn't sleep well? And then I had to be really honest with myself and maybe change my exercise based on how I felt.
Yeah. So you've already talked about some of the pregnancy symptoms, but can exercise help with some common pregnancy symptoms like back pain, fatigue, hip pain, things like that?
Yes. So what's interesting is that before, in my own pregnancy journey, I had several back injuries, and some SI joint issues from weightlifting. I was expecting while I was pregnant for those issues to become a lot worse because we become a lot more mobile when we're pregnant. So there's two main hormones when you are pregnant that increase. The first one is called relaxin. Now, relaxin kind of gets a bad rap because everybody blames relaxin on pregnancy-related hypermobility. There is some truth to that, but relaxin levels are highest in the first trimester, which interestingly enough is not when most women begin to have back pain and hip pain. The first trimester, they're really struggling just to like keep food down, or feeling queasy or just fatigued. And then those relaxin levels kind of stabilize. And then they spike up again in the last month of pregnancy. And that makes sense because we need to widen that pelvis for birth, right?
Mhm.
The other hormone that is related to pregnancy is progesterone, and progesterone is really the pregnancy hormone. So when you when you pee on a stick, that stick is measuring for progesterone levels and also HCG, which is human chorionic gonadotropin. And those are the two main hormones that will spike when you're pregnant. Progesterone has a relationship to ligamentous laxity. And we see this There's some literature that actually has looked at progesterone levels in women who are not pregnant. So think like high school and college athletes relative to where they are in their menstrual cycle. And when progesterone spikes in our menstrual cycle, our ligaments become a little bit more lax. So this might be why your back hurts a little bit more before, like a couple days leading up to your period. It's because your progesterone has spiked. Progesterone is spiking because it's preparing the uterine lining to be this nice, thick, cushy environment for an implanted egg to live and grow into a baby. If that egg does not meet up with its buddy, the sperm, and doesn't implant, then we have a period. So it's kind of the same function. And there is research that suggests that women who have higher progesterone levels are more at risk for, say, ACL tears or something like that, even if they are not pregnant. So managing those two hormones, we can't really do much because that's just the way it is. But exercise can help provide mobility in the areas that we need mobility and stability in the areas that we need stability, which is typically the low back, the hips, the pelvis, and the pelvic floor. And a lot of times women will end up with a decrease in low back or hip pain if they engage in exercise, rather than what typically people think is that if I exercise, I'm going to hurt myself, or my back pain or my hip pain is going to get worse.
Yeah. All right. So now that we've talked about some of the benefits, what are some common myths or misconceptions about exercising while pregnant? That you've heard or that you've seen other providers perpetuate?
My favorite is don't lift anything over 15 to 20 pounds while you're pregnant. And I really don't know, like, I would love to know where that started.
Yeah.
And why? Because, like, let's take you for an example. You're a power lifter.
Yeah.
What does powerlifting give you every day?
Let's see, it's great for just, getting my exercise in. I feel like it gives me a lot of structure. Like I have to be structured in my sleep and my nutrition, my time management, so that I can be a business owner and also train. It gives me a lot of just stress relief and kind of mental health benefits. Like I am always happier and calmer if I can get my exercise in the morning.
Awesome. So I would imagine that when you and your husband become pregnant, you're going to want to continue to do that.
Certainly.
Okay, because if you think about like life, having a baby is a big, huge life change. Like you are literally adding another person into the dynamic of your family, even though that person is very small and absolutely adorable and yet needs help with literally everything.
Yeah.
And so to take someone who is used to exercising at their first prenatal visit and tell them that they need to not lift anything more than 20 pounds when they probably did a 200-pound back squat the day before because they didn't know any better.
Yeah.
You can't go from active to zero, because it's basically what that would be, in the span of 24 hours. What does need to happen, and what I think in our practice we offer very well, is keeping mom active and teaching her how to make those modifications in a safe and healthy way.
Yeah.
So should you lift while you're pregnant? 100%. Is that the time to do a powerlifting meet? Probably not. I have seen it done. I coached 2 athletes through a powerlifting meet in 2019, and one of the women there, she was in her next weight class up than what she typically would have been in. She was 28 weeks pregnant. And I'm watching her and I was like, okay, I get it. Like, that's fine. But then I watched her put on a weight belt for the deadlift and I was like, no, this is taking this a bit too far. And I think that's where the big misconceptions are with lifting during pregnancy, is that we either say, don't lift more than 20 pounds, or yeah, you're fine, carry on, but we don't give any clear guardrails.
Yeah.
So here's the guardrails. You need to find either a pregnancy or postpartum physical therapist or a personal trainer or a strength coach who knows how to work with that population and learn how to correctly engage your abdominal muscles and your pelvic floor. The risk that we have in lifting with pregnancy is related to pressure management. And
Mhm.
so when we lift, we typically take a big deep breath in, hold it, do the lift, and then breathe out. That's fine. You need to do that to protect your spine. When you're pregnant, you're creating a lot of intra-abdominal pressure. It causes your blood pressure to rise. So that's something we need to monitor. It also creates a lot of tension on the pelvic floor. Your pelvic floor is already under tension because it's supporting the growth of this new human.
Yeah.
And so if you don't know how to engage your pelvic floor effectively, then and then you add lifting on top of it, you're risking issues later on down the line. And so finding someone who can coach you through that will help you be able to continue to lift while you are pregnant safely.
Are there any exercises that you really feel should be avoided with pregnancy, even if someone has like a coach or guidance?
Scuba diving.
Okay.
Scuba diving is contraindicated in pregnancy. Again, because of the changes in pressure and like you literally are having to survive on someone else's oxygen, blow up the tank on your back. Contact sports. So, if you're pregnant and you play, who was it? I don't remember her name. There's a professional women's soccer player who just recently retired because she's pregnant with her second child. And I think she played in her last game at like 23 weeks or something like that. I feel like her name is Alexis Morgan, but I could be wrong. Um, Soccer is a contact sport.
Yeah.
So we want to avoid contact sports like soccer, rugby, football.
Mhm.
And then any sport where you could fall. So downhill skiing, horseback riding, snowboarding, skateboarding. Bike riding is kind of a maybe.
Mhm.
I wouldn't do like downhill aggressive mountain biking,
Yeah.
so just it's really kind of think about it from a self-preservation perspective,
Yeah.
like what's not going to literally kill me. Those are the big ones that I would say are contraindicated.
Yeah.
Yeah.
What are some signs or symptoms pregnant women should keep an eye out for when they're exercising to kind of help monitor if they're doing something right or not?
So I would recommend for every woman who's pregnant to have a like a blood pressure cuff that they can use on their own. And I say that because preeclampsia, which is high blood pressure in pregnancy, is it does not discriminate. It is equal opportunity, and women who did not have blood pressure issues prior to pregnancy can develop preeclampsia.
Mhm.
And I speak from personal experience. I had preeclampsia in the last 2 months of my pregnancy. And my blood pressure normally is ridiculously low. I'm like 110/60, and people are like, "Are you still alive?" Um, so checking your blood pressure in the morning, maybe midday, and at the end of the day, I think is important. And then just look for trends. Um, you don't want to exercise if your blood pressure is above like 135/80 or 85. And that sounds low. But according to the American College of Cardiology, the new guidelines for pre-hypertension are actually not 140/90 like we previously thought. It's actually 120/80 and above is pre-hypertensive, and 120/80 used to be considered normal blood pressure.
Yeah.
So I think checking your blood pressure regularly is number one. Maybe track your levels of fatigue. If you are already really tired, exercise is probably not a good idea. Like your body's working really, really hard. I would also say if you have any persistent bleeding. So occasionally women will spot while they're pregnant, but if there is any persistent like second or third trimester bleeding, we absolutely need to have that checked out and make sure there's not something else going on. Obviously if your water breaks, probably not exercise.
Probably not.
Like let's maybe go see your midwife or go to the hospital. And then in women who are severely overweight prior to pregnancy or women who are severely underweight, they really need to be exercising with a professional.
Yeah.
because there are some not necessarily not just health implications for mom, but also like in utero developmental implications for baby.
Yeah. How do you tailor exercises based on different trimesters, or do you even do that?
I do. So first trimester, we're kind of getting an idea of how mom is feeling, levels of nausea. Some people, are fine. I hate throwing up. So I was nauseated for like 2 months, but I refused to throw up.
Mhm.
So I just like lived in misery. I've had some clients who never had morning sickness and just felt fine. And then I've had clients who actually had hyperemesis gravidarum, which is a like medical condition that is of concern because these women are like throwing up all day long. They literally can't keep food down.
Mhm.
And one of the things that you need to do when you're pregnant is take on a little bit more calories. It doesn't need to be a ton, generally 300 to 500 calories in excess of what you already have is enough, or just eating when you're hungry and stopping when you're full. That's a good way to do it too. But some women can't do that. So I, what was the question again?
Do you tailor exercises
Oh yeah,
based on
okay.
trimester?
So back to so if we have somebody who's sick all the time, we're gonna make it a little different. Like I'm not gonna put them through like, you know, a heavy Metcon,
Yeah.
right? Here's your puke bucket, keep moving, right? Um, you need to keep intensity in check. So there's been several articles in the last probably 3 to 5 years that have talked about like correct exercise intensity. And I think this came about because a lot of CrossFit, female CrossFit athletes have had very public pregnancies and recoveries. Andrea Nisler this year, like competed in the open, like 6 weeks postpartum or something crazy like that. And then won the 35 to 39 age group at the games. And, her daughter's like 6 or 8 months old. That's amazing and not typical.
Yeah.
And I'm sure that she actually had I know because there's no other way she could have done it. She probably had a really great support system.
Yeah.
And people like providers in her corner. In the first trimester, we're going to try to keep moving. We want to manage intensity. Intensity should not go above 85 to 90% of your max heart rate, or because max heart rate and rating of perceived exertion are so closely intertwined. If your rating of perceived exertion on a 0 to 10 scale is an 8 or above, you need to dial it back. And it's not necessarily because we're worried that you're going to do something to hurt yourself. It's because of bringing it all back to our placenta and blood flow. When you exercise, your body is going to naturally shunt blood away from your organs into your peripheral working muscles. For someone who's not pregnant, that's fine. Like you're still getting blood, to your lungs and to your heart. But like, let's talk digestion. If you're working out, your body is not like, hang on, let's digest our food.
No.
It's going to shunt that blood away to working muscle and put digestion on hold a little bit. And then when you're done, if you've ever had, I used to call them the runner's poo, right? Like you go for a run, you feel fine, and then you get done running and you've got diarrhea for 4 days. Well, maybe not 4 days, that's another problem, but like a couple hours. It's because all of that blood that was in your periphery gets shunted back into the digestive system and things kind of speed up.
Yeah.
Similar thing happens in pregnancy. When we have that blood flow that's shunted away from our organs, we actually have a decrease in fetal blood flow above 80 to 90% effort. We don't want that because baby needs that. Like that's how your baby is getting their nutrients. So throughout all of pregnancy, I try to keep women below that 8 or 9 out of 10 RPE. When it comes to weightlifting or strength training in the second and third trimesters, as your belly gets bigger, your center of mass is going to change. So you might have to make some adaptations in terms of squat depth. For Olympic lifting, you might have to think about changes in bar path. I actually think my bar path got a little bit better when I was pregnant, but so those kind of alterations. But other than that, again, if there's no complications, then keep on trucking.
Kind of related to that, I know core strength is kind of a controversial topic
Mm.
in pregnancy. Can pregnant women train their core? If so, like what is safe, what isn't safe? How do you kind of navigate that?
Pregnant women absolutely can and should train their core. Um, one of the, I think one of the bad raps that core training has is the risk of diastasis recti or abdominal separation. Um, the risk is inherently there because depending on how quickly your belly grows and how quickly your baby grows, you're asking tissue to expand beyond its capability in a relatively speaking short period of
Yeah.
time, right? But when it comes to diastasis, there's kind of two different things to think about. Is it and you might see people referred to it as coning, where like the abdomen kind of looks a little bit like a cone head, so it kind of comes up like this. I like to call it the bread loaf because sometimes it does look like a loaf of
It
bread
does.
sitting there. Um, Coning or bread loafing isn't necessarily bad. It's the type that's bad. So if that coning or doming is soft, that makes me a little concerned because that means that maybe we've separated so much that we've got visceral tissue that's coming out through that abdomen. Whereas if that doming is hard, it's doming, but I still have some abdominal wall that's
Mhm.
intact. So that would be my first thing to assess. Is there a diastasis? If it is it a soft dome or a hard dome? But core strength, you're going to need for labor and delivery. So the uterus is going to be what actually contracts. The uterus is a smooth muscle, so it does have contractile properties, and that's what a contraction literally is the uterus kind of doing this peristaltic contraction similar to like what the gut does to move food through. But you also need to use your abdominal muscles to help that contraction push baby out. If you don't have good core strength, you're going to end up bearing down like you're trying to take a big shit. And if you don't have good core strength and your pelvic floor is not able to relax, that's when we start to see vaginal tearing, pelvic organ prolapse, and other kind of issues. So core strength is a 100%. I love planks. You can do a plank on a wall. You can do a plank on a bench. You can do a plank on your knees. You can do a regular plank. Um, if you can teach someone how to do a plank with a good like transverse abdominis belly button into your spine, or when I work with pregnant women, the cue that I give them is use your tummy muscles to lift your belly. And you'll be able to see the belly just kind of lift up. If they can do that and continue to breathe normally and do a plank, that's a great way to start for core strength. Side planks are great. I don't love sit-ups, but I don't love them for normal people. So like I don't think that's really necessary. For people who do CrossFit, like toes to bar or things like that, I think are fine. Usually your belly's in the way. Like you can't get your toes to the bar, not because you don't have the strength or it's too hard on your abdominals. It's because you got a belly in the way.
Yeah.
So swap that out for like hanging knee raises or knees to elbows, or something like that. But yes, the short answer is you absolutely should do core strength.
Excellent. All right, so last question here for you. Why do you think there are so much fear and so much like misconception and false or questionable information surrounding exercise and pregnancy?
So this is a great question. I think there's a lot of misconceptions for a couple reasons. Having babies, and this is great. What I'm about to say, I think is very controversial, but it's
Excellent.
the truth. There are two things in human society that have been around longer than anything else: having babies and prostitution. People have been paying for sex for as long as humans have been in existence, either monetarily or, favors, whatever.
Have some woolly mammoth and come over here.
Yeah, like I got your woolly mammoth, I got your food for the winter. Get on in my cave, woman, right? And then what happens? Oh, we have a baby now. So things that have been a part of human experience and human existence also have stories tied up in them that get passed on from generation to generation to generation. Think about like the 40s and 50s. Women used to smoke while they were pregnant. Like nobody said that was a bad idea.
No.
Our parents were probably born in the 40s and 50s. Literally turned out okay.
Yeah.
I mean, relatively speaking, right? So there have been a lot of societal norms around pregnancy over time. In medieval times, in your last trimester, you were they called it confinement. So they actually looked at pregnancy as ugly, and no one wanted to be seen with this big old belly. And so you would just hole up in your house. And then in the postpartum phase, they thought that sunlight was bad. Can you imagine? I just had a baby. I've got postpartum depression. And also my, castle staff won't open the windows so that I can get outside. So I think a lot of these traditions end up being accepted as truth. And that's where a lot of these things come from. So I think that's one part of it. I think the other part of it is that, unfortunately, in this country specifically, we are a very litigious society. And OBGYNs have the highest malpractice insurance premiums of most healthcare providers because there's not just one patient that they've got to worry about, there's two. And labor and delivery is incredibly unpredictable. You can have a super healthy pregnancy, everything is going fine, and then stuff just absolutely goes sideways. Because it's so unpredictable. I think in trying to control for that unpredictability, healthcare, medicine puts parameters around women to try and control that.
Yeah.
And in science, all it takes is one or two, I can't even say well-designed studies because it only takes one mediocre study that's published in a not mediocre journal for people to start accepting it as gospel.
Yeah.
What I found, I've been working with pregnant and postpartum women for over 15 years. And what I have found is that if you empower mom and teach her to really listen to her body honestly and provide her support and like the village concept, their bodies, mom and baby, their bodies know what to do. Give them the time and space to do what they need to do. And everybody will probably be fine.
Awesome.
Yeah.
Any parting remarks for us on exercise and pregnancy?
I think for moms, I would say stay off Instagram.
And Google, I would add.
Like, yeah, like don't Google your symptoms. Don't go on Instagram and see like what the newest, hot pink matching sports bra, leggings, white sneaker influencer has to say about pregnancy and postpartum exercise.
Yeah.
Like, go find someone who actually has gone through additional training to work with that population. And do your homework. Like, ask them hard questions before you agree to work with them.
Absolutely.
And I would also say, and this is only because I had a call with a prospective client earlier this week. You need to budget for yourself when you're pregnant. So a lot of women and families will budget for the hospital stay, or they will budget for the crib and all the baby gear and stuff like that. And then they forget to budget for their own health care. And unfortunately, pregnancy and postpartum PT is not a standard of care in this country.
No.
You have to ask for it. And depending on your insurance company, they may or may not approve it. So you need to be prepared to potentially pay out of pocket for it.
Yeah.
And if you can budget for that, you will be so grateful that you did, because it will make your labor and delivery and then subsequent pregnancies go even better.
Absolutely. All right. Well, thank you for sharing today, Megan.
Thank you. Yes.
And we'll see you guys next week.
Awesome.